My name is Vicki, and I will be your conference operator today. At this time, I'd like to welcome everyone to the OPA Stakeholder Briefing Conference Call. Lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question and answer session. If you would like to ask a question during this time, simply press star, then the number 1 on your telephone keypad. If you'd like to withdraw your question, press the pound key. Thank you. Ms. Elizabeth Abbott, Director, Office of the Patient Advocate, you may begin your conference.
Hey everybody, can you hear me? Hope? We're working on it. I'm the Director of the Office of the Patient Advocate, just about completing my first year on the job, so I'm happy to sit into my second one of these. It's a preview of our 2015-16 edition of the Healthcare Quality Report Cards. Those of you who are hoping to log on to the Panda Cam, Washington Zoo, you're probably on the wrong call. That's probably a little more fun of a one, but this one's going to be pretty swell too. We are doing this webinar, and we'll be posting on the OPA website under our What's New section. We'll try and arrange for questions, take questions direct. Here's what we're going to cover. Have a quick review of what our charge is for the Office of the Patient Advocate, because that has changed. Many of you have been following along on that. And I wanted to introduce our new Deputy Director in a minute. Talk about principally California Healthcare Quality Report Cards and the changes that are coming to those, and what it looks like as they're about to be unveiled. Also, what's going to be happening later in the year in early 2016, which are some pretty significant changes. In terms of what the Office of the Patient Advocate, or OPA as we are known fondly, we are responsible for healthcare report cards. And our next new signature item, which will be debuting soon, are complaint data reports and baseline review of state consumer assistance call centers. And we that and posting it to our website. And we have to do this annually. This is not a once-in-a-lifetime opportunity. We get to do it every year. Also charged with developing model protocols for state consumer assistance call centers with recommendation about referrals of calls. I'd like to take a minute to introduce our new Deputy Director. Several of you may have worked with Barbara Marquez, who had been here for a number of years, and we wish her well in her retirement. And we are delighted to introduce Marisha Avery, who is Deputy, who's been here a few months, and I'd like her to say hi to all of you and tell you a little bit of herself before we go on.
Thank you, Beth. Hello, everybody. I am so pleased to be here. This is my first webinar at OPA, and I'm really proud to be a part of such a really important project. I'm OPA from the Department of Social Services, where I started my state service career. My first really was in the child welfare program and doing policy work, and I had a wonderful opportunity to work on the Title 40 waiver demonstration, which really allowed participating counties to use child welfare funding without any of the restrictions that come with Title 40 dollars. And to be families have access to a full range of services. And that particular position was really exciting because I felt that my job coming to state service was going to be so different from the direct practice work that I had been a part of for a number of years, and it was really an extension of the kind of advocacy work that I'm really excited and proud to be a part of. I did work for 11 years as a social worker, and had a wonderful opportunity to gain a lot of direct practice experience from assist victims of crime to also worked in foster care, and then a number of years in hospital and healthcare services as a medical social worker. I worked mainly at the Marshall Hospital in Placerville, where I had an opportunity to not only be a part of their committee for their accreditation of the hospital, but also to be a part of the Ryan White program and co-chair their committee work to assist victims with HIV and AIDS. So I healthcare field for a number of years, and I really feel like the work that I have done in the past has led me to the office of the OPA so that I can continue on working and helping consumers gain access and get good information about what's available and what might be of some assistance to them. It is my desire to see that the report cards continue to be an invaluable resource and to provide useful and relevant information to consumers. And there are so many exciting things that are taking place with the report card. As you will hear later on, Barbara has a number of things to tell you about some of the changes that are taking place. And I'd like to thank you for joining us today and invite you to share your thoughts. Partly what is useful to folks is really hearing what's going on and getting your input to be able to help us make this not a report card, but our office serve the consumers. And so I'm just really excited to be a part of that and really invited to share your thoughts as well. So now I'll turn it over to you, Beth.
Okay, the first thing I want to do is acknowledge all the partners that help us with this endeavor, with a significant one. We do the report cards annually for our principal, but not perhaps even all of the people who help us do it. The Integrated Healthcare Association, IHA, which many of you know, belong to, associate with, the Healthcare Performance Information System, the Cal Department of Insurance, the Department of Managed Healthcare, the Committee on Quality Assurance. Many of you know that NCQA is a public reporting contractor, as is the Institutes of Research, AR, who do a lot of the consumer testing for us. So these people are all critical to this endeavor, to our success, and so they'll make them as well as us. So now to get into the real important part of this is some of the things that are new and different, revised, updated, and highlighted for 2015-16. I'd like to introduce your research person, Ms. Barbara Mendenhall, our OPA staff. Barbara?
Thanks, Beth. So I'll give you a little background first. Just not everybody on the call has been familiar with the report cards, and so we'll do a little just overview of what it's all about and how they operate to start with. As you may know, the 2015-16 edition report cards will contain the measurement year 2014 clinical and patient experience scores and ratings. We display more than 3,000 charts in the online report cards. We have updated profile pages for 16 health plans and 207 medical groups for this new edition. We represent care for more than 16 million commercially insured residents of California. Our targeted release date is October 8th, 2015, coming up in just about 6 weeks, and these will be accessible to millions of California during the fall 2015 open enrollment. We'll go on and take a look here at this just the main pages from our three primary report cards, the HMO report card, the PPO report card, and the medical group report card. There is the same look and feel across all of our report cards. We do report on 10 HMO plans, 6 PPO plans, and as I said, the 207 medical groups that contract with those 10 HMOs. We for unity of design and information. We want the information to be understood quickly and we provide key information about what's in each of these pages within the report card. In addition to the online internet-based report cards, we do have mobile apps for Android and iPhones, and these were developed in partnership with the California Department of Health Care Services to make the report cards more accessible to many, many, many people who are getting most of their online information through their mobile apps, through their mobile devices. The apps are currently being updated to be more interactive, and they're also being built in a new platform that is not separate Android and iPhone apps coming up soon. It's a cross-platform application. Any more interactive so that viewers can quickly access the information that's most relevant to themselves. So who uses the report cards? Obviously focused on consumers. We write the text and the descriptions in the report cards focused on consumers at that health literacy level. It's important to consumers who might be selecting a health plan or medical group, using their benefits or making other healthcare decisions. We also target the very sophisticated industry folks, such as those of you who are on the telephone, researchers, purchasers, one trying to find reliable, independent information to understand the options that are available to make decisions, whether choosing a health plan or understanding what the rates are for other people, other plans or medical groups. I did have a recent phone call with a consumer who wanted to use the report cards to choose a health plan, and I was able to walk her through the 3 levels of depth from the overall ratings to specific measures for the topic she was most concerned about. And her takeaway was that this was information that really took some of the pain out of comparing health plans. That's our goal with the report cards. We also print report card brochures, and we've got the front cover of our 2014-15 report here. Excuse me. They're in English, Spanish, and Chinese. They describe the information that's available online. The online report card information can help viewers make decisions about choosing a health plan, healthcare provider group. And we do make those brochures available online. They can be ordered from us in bulk, and we're very happy to send them out to anyone who can distribute them to patients or others. And we encourage you to use the brochures, and don't hesitate to contact us to get us to send you them so that you can distribute them. So moving along, where does this data come from? Clinical data and patient experience data are all, we rely on national and California collaborative organizations who are charged with or focused on improving and reporting on healthcare performance quality. The collaboratives that produce the data include the participation of healthcare experts in developing and updating measures. We just lost our screen, so we'll try and bring it back. And so people who are developing, updating the measures, they're healthcare researchers, healthcare providers, and healthcare staff who are focused on quality improvement, as well as employer, purchasers, and others. We do also have a very rigorous advisory process that focuses on transparency, collaboration, and alignment. We participate the IHA Technical Measurement Committee and ask them to review and advise on the HEDIS, the non-HEDIS, and the CAPS methodology changes during regular meetings each year. And you can find their member roster on the IHA website if you're interested in that. We also work with California Healthcare Performance Information and their independent decision-making process related to the medical group patient experience data. We consult with an independent academic and clinical expert, Dr. Patrick Romano, who's at UC Davis. We also require and have a process where medical group and health plan representatives, the folks who are being reported on, annually review their star ratings and their organization information as part of the quality assurance process. And that preview is scheduled for September 23rd, and we'll have a similar webinar at 10 o'clock in the morning. We also work to align the healthcare quality report cards with California, which is also very interested in reporting on quality information for the plans that they contract with. So the plans and the medical groups are important partners in doing our final and ongoing quality assurance review, and we always want to hear from you if you find information that needs to be updated or revised. Even outside of the annual update process, we can go in and make changes to improve the information. The next thing I want to talk about is the type of data that are on the display pages. There are 3 levels. We have the top overall summary page for each report card, and then we can drill down to up to 9 condition summary topic ratings, such as healthcare, diabetes care, and so on. They're all listed here. And then below that, we have up to 47 measure displays where we have the ratings for each individual measure. Overall summary star rating includes 2 to 3 composite or single measure ratings on that top page. The condition or topic ratings are also composites that, or they be single measure ratings, and these are organized into those relevant topics that have shown utility for viewers. And those who are interested in the detail that make up the star ratings can drill down to the single measure displays. We also disaggregate the combination measures to display both components, such as showing bar charts for both quick initiation of treatment after diagnosis for alcohol and drug dependence treatment, as well as the ongoing treatment for that diagnosis. And we include a fairly large number of measures, so those who want to dig deep start with the top measures with only a few ratings, and a quick overview for each rated organization, or drill down to the detailed pages. So we'll go in and take a quick look at each of those types of display pages. So here's an overall summary page. This is the HMO quality rating. This is our original report card, and it remains a very important piece of the healthcare quality report cards. Pages provide an immediate picture of healthcare quality for each listed organization, and they provide quick links to the condition topic ratings, both the clinical care ratings in dark blue box and the patient experience ratings in the light blue box on the right of the chart. Those are links that drill down in the next level of page, which are also, many of them are star ratings, and we illustrate here the asthma and lung disease care summary for the, this is the April report card. And again, this provides an immediate picture of quality for each organization on the specified healthcare topic, as well as quick access to the specific measures that go into this particular star rating through the links in the dark blue box on the right. And we go down into those linked ratings, we get to the measure pages, which show a bar chart, and they show the percent of patients getting the targeted service or reaching the targeted outcome. Health plan report cards include a reference line showing national 90th percentile for that same type of plan. HMOs are compared to HMOs, PPOs are compared to PPOs. And that there is limited text initially shown on the pages, but that the viewer can read more to learn about what is being measured, what's being measured, as well as the source of the data. And we can go to the next slide and see one example of that measure description, where we the same format throughout. Again, we try to have this easy so people know what to expect when they get to each page. And during consumer testing, viewers let us know that they expected to learn why each measure is important, their doctor should be doing regarding the measure, what the patient might be doing, and where data come from, and what the rate means. Make sure viewers also know that the doctor and the plan may have additional programs and services on this topic to help patients with their specified healthcare condition. New information being added this year is the minimum number of patients that are required to present information on the measure for a plan or group. And you can see in the very bottom line there that these scores are based on information from at least 30, for this case it's in the PPO report card, 30 PPO member administrative records in 2013. And I turn the discussion over to NC2A at this point to continue to talk about the changes coming up for the 2015-16 edition.
Great, thank you, Barbara. This is Lana Burke from NCQA, and as Barbara mentioned, I'll go over the changes coming up to the methodology for the 2015-16 edition, but first I'll just give a quick view of sort of high-level basic methodology. So the methodology for calculating the star ratings is based on a relative comparison. So the points for assigning the star rating for both the clinical measures and the health plan member experience measures are based on prior year performance, unless there has been a big change to the measure from year to year, and in which case the prior year data is not comparable. And we use the same year of measurement. So the health plan report cards, that's the HMO and PPO report cards, we use the national all lines of business HEDIS and CAPS performance data from Quality Compass to identify cut points for each of the star ratings. For the medical group report card for the clinical data, we use the aggregated all participant data from the IHA pay-per-performance program, and data is provided by IHA to OPA. And the whole group report card patient experience information uses methodology and cut points developed by the California Healthcare Performance Information System, or G, which compares to a selected prior year for a set period of time before the bar is kind of reset periodically. So, as I mentioned, reporting year data compared to the prior year. For the upcoming 2015-16 edition, which will be launched in October, there's actually only one measure that is not trendable, meaning we'll use the same year of data instead of prior data, and not be giving lab tests for patients taking medications for a long time, or for those of you who are more familiar with the HEAP and P4P names, that would be the MPM measure. And this only applies to the adults topic rating for the HMO and PPO report cards. Have much more in-depth descriptions of the methodology posted on the website. So here are the links where you can find the current methodology documents. maybe the 2014 to 15 edition, or the edition that is currently posted, and we will be updating these documents for the 2015 to 16 edition, and we'll be sending those to all of you prior to the September 23rd to 29th industry preview period. So prior to the release, we will be sending you the updated methodology. But things slides, I'll go over kind of what will be different about this year. So, geez. Click the link. Okay, back to the slides. So there's a few changes we want to go over. There are some tired measures for this coming year. There's some measures added and a couple of small scoring changes. So we'll go over those now. So I'm sure most of you are familiar with the changes in medical care guidelines for managing cholesterol, which has meant that cholesterol-related measures have been retired from both HEDIS and from the Pay for Performance program. So these measures have actually been removed from the report card, and at this time they've not been replaced, although both NCQA and P4P are adding new measures, and we hope in the coming years to have new measures for the heart care topics to replace the measures. The second set of measures that have been removed for this coming year are some supplemental CAPS measures that were on the HMO and PPO report cards. These previously been an optional reporting option from the health plans, are not included in star ratings. They were just considered standalone measures, but we were only receiving that data from a few plans, so OPA has decided to stop reporting those measures. In new measures, there's a new star rating. For those of you who are familiar with current report cards, you'll know that members rate their HMO. It is a star rating on the current HMO report card, but there was no corresponding star rating on the PPO report cards. That has been added. And additionally, there's an individual measure rating, so those bar charts that Barbara showed earlier for this measure for the PPO report card, but no corresponding individual measure rating on the HMO report card. So now this measure is reported both the star rating and measure rating on both the HMO and PPO report cards. And again, just for those of you who may be more familiar with the HEDIS and CAPS names, this is the health plan highly rated measure, in case you're more familiar with that name. And there is one scoring change for the HMO and PPO report cards. This is for the measure we just talked about, members rate their HMO or members rate their PPO, and so an individual measure rating, health highly rated. And so previously, the OPA report card looked at a plan that got an 8, 9, or 10 on the CAPS rating for this. And we have moved to just scoring 9 and 10 scores. So pause there for some questions. And I wanted to let everyone know that Vicki Operator will remind you how to ask questions on the phone, but we also, if you want to type questions into the chat webinar, we can take those afterwards as well.
Yes, and at this time, I would like to remind everyone, in order to ask a question, press star, then the number 1 on your telephone keypad. And that's just for a moment to compile the Q&A roster.
Thank you. And while we're waiting for that, we actually did get one question in the chat asking about the complaints data. So all the way back on slide 3, the question was about what are the sources of the complaints data. So I'm going to go all the way back to slide 3 because these are going to be sent out and posted on the OPA website. But I'll just remind everyone that the data submitted for the complaints data comes from the Department of Managed Healthcare, Department of Insurance, the Department of Healthcare Services, and Covered California. And I know if OPA, if you'd like to expand on that at all.
This I'm going to mention just a little bit in the next section about what's coming up. So maybe I'll answer your question in connection with that part.
Great, thanks. Any questions?
You do have the question from the line of Teresa Hodgins.
We're wondering, for the 2015-2016 data launch in October, data is going to be from what year?
So measurement year 2014. That gets a little bit confusing depending on which report card you're talking about. So for the HMO and PPO report cards, that is from 2015 data, so the data that was just released in Quality Compass. And for the P4P program, that's measurement year 2014. So they're the same measure year data, they just are a little differently depending on the program.
Okay, thank you.
And no other questions at this time.
Okay, I'm just gonna any questions that have come in through this. We've got a couple here, so just get through here. So one question is the 4-star rating the standard, or are some agencies using a 5-star approach? And is this potentially confusing to consumers? To address that, or would you like me to?
Beth, I will start. It is potentially confusing for consumers, and that's we have under active consideration to coordinate our ratings with at least one principal people who are about to go to a 5-star rating, which is the California report card. So that we hope to do it in sequence with them, because hard consumers say, well, you have a 4-star rating, I want those 5-star plans. So we are mindful of that, and we think it's important that they be synchronized as much as we can. It is determined by the Centers for Medicare and Medicaid Services who determine the timing and when that starts. So we are active consideration to change that perhaps the year after that, depending on when it seems to make the most sense.
Thanks. So we have a few more questions that have come in through chat. The next is, has diabetes hypertension medication measure been removed? And I actually believe that there was in the pay for performance measure set just for Medicare. So that actually is not currently on the report cards, although we have a related question set. And the answer is yes, that measure has been removed from P4P. And I'm happy to follow up directly with that person if you have more questions about that. So we have another question, which is, can we put a link of our medical group website to the OPA report cards when they are published? And if the person who asked this question wants to pipe in on the phone, let me know if I have misunderstood it. But kind of questions there. Every medical group that is listed on the report card does have a profile page. Profile page, we ask the medical group to include their website, their phone number, and some other information about IT use, the number of physicians they have, and also what counties they are in. So that is correct. I'm not sure if the question actually meant can our own website, can you link to the OPA report card, which Beth, I'm not sure if there's an official answer on that.
this has been, I think we not only permit it, we'll be wildly enthusiastic if you did that, because we think we want to stress quality in every venue and want to have people be aware of this is not just sort of a guess about what quality is. We've got a lot of data that has quality information. I think it is a real tribute to people who do hands and medical groups, people. So if there are questions about the mechanics of doing that, we can certainly hook you up to the right people to do that. But I would really urge you to do that, because I think it's a great inducement for people to look at that data and help that be part of their consideration of selection of their healthcare provider team.
So kind of just moving down the questions here in the chat, another question is, publicly reported metrics on the medical group report card used in the STAR methodology be identified to differentiate them from those metrics that are for display only? And the answer is yes. So if I'll just click back a couple of slides if I can. The methodology documents, which we included the links to, those do include detailed description of which measures are included in which topic and category STAR ratings, and there are appendices at the end of documents identify which measures are display only. So that is good.
You can also tell by looking online where there's a page with a STAR rating with the links to measures that go into making up that STAR rating. If there are additional measures on that topic, they would be listed as measures on this topic and not be included in the group of measures that make up the STAR rating.
Thank you, Barbara. So I've just gone back to the screenshot of the asthma and lung disease topic condition page on the HMO report card, and you can see on the right-hand side the measures here in this blue box are all the measures that make up the STAR rating. The medical group report card topic pages are set up in the same way. Then the question we've gotten from the chat is that you mentioned earlier that OPA aligns report card efforts with Covered California, and could you expand on what you mean by that?
We're talking to them quite a bit about that. Of course, their report cards reflect that this is the first year that they're going to have data for just their members who enrolled on the change. And so they are sort of veiling that. We, of course, have, please don't quote me on this, but I think their membership is like 1.3 or 1.4 million. OP report card reflects a little more than 16 million commercial employees. So the change is particularly interested in having the experience and the measurements reflecting their own consumers. So we're trying to make this as seamless and transparent and describe what the differences are and the similarities. It's going to be really easy to do, but it's not particularly easy to do because we want to make it very clear, but we also want to show we're not responsible for releasing or providing report cards for the exchange. They certainly are working on having that information on quality be available through their own website. But we're trying to make it not similar that people can't figure out why it's different and what it says. So we meet with them on a regular basis to coordinate our efforts and make sure we use, Alana Burke used the term cut points in the past in this discussion, which are like the curve that you're grading on for a test. So we're going to make sure that all of the things that we can align, that we do align. it is an ongoing discussion with them, and we think it's important to do that because we are dealing with a subset of, or identical, virtually identical types of consumers. There's something else coming that I'll talk about in a minute or two about what else we're adding in that regard. But that's my version of what's going on.
Beth, and there was just a follow-up question on the Covered California, which is, are California members included in these ratings? The patient experience and quality ratings are members included, and they are not included in HEDIS reporting. So this data comes from HEDIS for the health plan report cards and from P4P for the report cards. We're not getting data from Covered California.
Wouldn't patients who are getting coverage from commercial health plans through California be part of the population that would be included in the Quality Compass, HEDIS, and CAPS data?
Not. The Covered California is actually a separate product, so they're not included in HEDIS reporting.
Well, that's new to me. Thank you very much.
Question from the chat. So we did one question about our Medicare HMO P4P results going to be included. I think Beth, you're going to talk about in a minute, so we'll leave that question. Got one question about do the patient experience measures have the same requirement of N greater than 30 for the reporting? I can say for the CAPS measures, so the patient experience measures that are included on the plan report cards, there is a minimum of 100 for the CAPS measures, 100 respondents, and for the medical group patient experience questions, I believe it varies by question, and we will have that information on the report card. We'll be adding that this year. What the minimum N is for each question. That's on the medical group. CAPS is not 30. It's not the clinical measures. Just getting a few more questions in. Someone who just at the beginning of the presentation asked where is the data coming from. I can remind everyone we are recording this and we will be sending this out, but just as a quick reminder, data for the health plan report cards, that's the HMO and PPO report cards, comes from CQA, HEDIS, and CAPS data. And the data for the medical group report card, the clinical data comes from the IHA paper performance program, and the patient experience data comes from the California Healthcare Performance Initiative System, or CHIPI. That's that. Seeing more questions have come in. There's another question about how we anticipate reporting out the complaint data. So, Beth, I know you're going to speak about that shortly. Yes, and perhaps you could address that. And Vic, are there any more questions on the phone? I think we've gotten through all the questions on the chat at this point.
No, there's no other questions at this time.
Great. Thank you. I jumped around a bit in the presentation, so let me just advance here. I'll just go over a few important key dates. So we've mentioned before earlier in the presentation, the health plans and medical groups are given opportunity to preview the updated star ratings and profile information prior to the public launch. That's from September 23rd to the 29th, and we'll have a kickoff webinar, kind of with instructions and a walkthrough of the launch, the new website on September 23rd. So anyone who received information about this webinar will receive that. If you were forwarded the information about this webinar, or you got it from a colleague and you want to be added, please let us know. And there are some contact information on the left slide. But so that's for medical groups and health plans. We'll get that opportunity to preview. And the launch date that we're looking at is October 8th for the public release of the new report cards. I'll turn it back over to Beth Abbott.
Okay, I'm going to wind up with what I call, it's the tier of coming attractions. Normally when you go to the movies, that's at the beginning, but I planned it at the end, so you know what's coming up. And there are a couple of questions about our healthcare complaint, consumer complaint. And some of you have are this coming and what it's going to look like, but let me tell you what it's going to be. I'm really proud about doing this. It is based on a state law that was passed for 2015. We'll be releasing information about consumer complaint data for the 2013. It will be from data furnished to us from the Department of Managed Healthcare, the Department of Insurance, California, and the Department of Healthcare Services. And that report is under review presently. When it's cleared and signed off and everything's super good, it will be posted on our website. We'll probably do some webinar. I'm not sure exactly what we're going to do to people know, but these are really excited about this because it's a signature activity very similar to the report cards, and it is the kind of thing that we have asked for information about complaints. So we ask for disaggregated information, which is does say the person's name, but gives them an entry code number, is identifiable by which the source it comes from. It has so it has the person's identifier, their gender, their date, age, county and zip code, the nature of the complaint, who was the regulator, who did they give the to, what was the complaint, how long it took for the organization to whom they reported it, resolve the complaint, what the resolution is, health plans, and we're using modification of the National Association of Insurance Commissioner Complaint Code, which is close to a national lexicon of what complaints are. And this first year, the legislature has asked us to develop a baseline information, and then we have to do this every year. So next year, we're going to do it all over again and see what the longitudinal kind of what we think the changes are, what it means, what some of you may have seen the Consumer Reports that talked about consumers really don't know where to complain, who to complain to, what to do, have a problem, or if they even have the right to complain. I think nationally, which is not the national figures, but it is 87% of consumers have not the faintest idea that they can complain, or if they wanted to, who they would go to. So we are the first state that's doing something like this in this elaborate way, and it's been a lot of work, I'll tell you that. But anyway, the information is all embargoed right now, so it is something I can discuss on this call, but I very much hope that it will be reachable very soon, and I think it's an important tool for consumers to be able to use that as one metric where they try and figure out who does a job, who does a really terrific job with consumers being responsive to complaints. And we very much appreciate the support and contributions of this joint endeavor that we've had from Department of Managed Healthcare, Department of Insurance Covered California, and the Medi-Cal folks. I don't know exactly when it's coming out because it's just not published yet, but we'll get a little publicity about it, and it will be, I get some attention. We're mostly on another issue, the access compliance information report for HMO health plans, working with Department of Healthcare. They're collecting the data, but we are their public reporting partner in this, and it's a key protection for consumers that was enshrined in law. I'm surprised that maybe not the world's longest law to be implemented, but it is. It's technically difficult to get specific information, but highly reliable. So it's being with great care by our colleagues at the Department of Managed Healthcare, and we're working closely with them on that. But that is a really important thing, and it's one thing to have a consumer say, "Well, I'm entitled." Knox-Keene Act to get service, but if I can only get service from a care practitioner a year from Thursday, that's not that good of a measurement. So this is an important upcoming measurement that we're going to be publicizing. We're doing a little bit of changes to our website, so there can be some filtering and sorting, kind of a new look to it. So we are hopeful that that's going to be an improvement. And the things that are going to be changing, not in 2015, but I hope by spring of 2016, and we'll see if we can pull this off. We are adding a total cost of care measure to group report card, and have a report that has some info on that. And it is not, I'm careful how I describe this, because it's not going to be like, if you go to this medical group, your doctor's visit will be $65. It's not going to be like that. But it's going to be showing 3 measures, which are average cost, lower than average, and above average cost. It's based on an amalgamation of a lot of that contribute to the cost of that care. And we're doing consumer testing now to see exactly how we should display that. We're doing, of course, as you know, stuff on the report. The tricky part is how we display cost, because there perhaps is an understanding among the general public that if something is a high cost, so that the higher the better, and that's not necessarily so. There are lots of things that are done very well by providers and healthcare professionals that are not the highest cost thing, and I assume that you all see what we see, which is an increasing interest in the cost of health care and changes about by the Affordable Care Act, and how can we afford this if we say the sky is the limit. So we think that's an important measure to include, but how we display it is yet to be determined. So that's why I can't give you an exact date on that, but I think that's way cool. And we might be the second state that's doing that. So we'll see if it looks, but that's a little bit farther out. And the last thing is the Medicare Physician Group report, which the Integrated Healthcare Association has had and displayed for a long time using the Centers for Medicare, Medicaid Services, CMS data, which they don't release until this fall. But IJ has approached us about incorporating that onto our report card page and for Medicare beneficiaries, because our report card only collects information for commercial members up to, not including Medicare. Although this information is available now through IHA, it's not widely viewed. And what IHA said to us, we'd really like to have it someplace where people can look and make best use of it. So we are in the process of redesigning it, making it look. We already have a link to it on our website, but redesigning it so it looks like our report card, and make it an add to our report card, and not just a link that looks sort of different in color and symbols. So it'll probably be going up, we hope, after the 2016, maybe spring as well. We'll probably do some publicity on that as well. Those are all good changes that we have. There seems to be, if I were to say this, actually there seems to be a lot more interest in quality, and maybe even a proliferation of report cards, but there also is a sort of a that we should have so much fragmentation of report cards, and let's try and consolidate them. And so I'm pleased that the Office of the Patient Advocate is the approach to take on some of these, and that we can do it in a way that is visible and coordinated and useful to consumers and to our care professional partners and organizations. So that is what's going on in things that are in the next 6 months, probably. In talk, just to make suggestions or talking to OPA directly, my is up there. Anisha, our deputy, her email, Barbara Mendenhall, who knows like way more than I do for sure, is there, and of course the NCQA is with technical issues really should be the people to whom you address your questions. That all of us are willing to help and are interested in your feedback and or compliments even about the report card. This is our 15th year. We're pleased punch to be doing this. We think it's a real important activity, and we welcome everybody's cooperation and support for this. Do you want to say anything else?
No, thank you, Beth. We did have a few more questions come in through the chat, although we are at time, so it's up to how you would like to handle those. I'm happy to read those off if that works, or we could back to folks individually as well.
I think if we have the time, we should do those questions now so everybody can hear the benefit of what other people are querying about. So if you all have our commitments for something else, you're excused, and want to hear what other questions have filtered in, then please stay on for a few minutes.
And as I said, we are recording this, and that will be posted. So for anyone who has to jump off, we'll be able to hear that. So a couple of very specific questions came in about the complaints data. One was, will the complaints reported out include only substantiated complaints or all complaints, including those unsubstantiated? A similar question about the complaints data. Will the complaints data be reported at the plan level, and will plans be rated on the number of complaints, and will medical groups be rated on the number of complaints?
They are reported to us by the purchaser and the regulator of health plans. So any of them that are frivolous or not substantiated will not be included in this summary. We're trying to work on now is how we display these ads, because it is it is indicative of the severity and performance. I mean, how a plan does or how a plan does is important as a measure of one way of their customer service. It's not internal plan complaints, but these are ones that are given to Department of Healthcare or CDI. And the thing we have endeavored to do is to ensure that we have these in a context. So if you have your own health plan and get 150 complaints and you have 450 enrollees, it's not too red hot. But if you have 150 complaints and 1.4 million consumers, that's not too bad. So we're trying to put it in a way that describes the complaints based on the size of the plan. So that's one of the struggles that we're trying to formulate that in a sensible fashion. We're going to add it when this is final and ready to go. We're going to put this on our website, and it's going to be tied to report card as one measure. I mean, we don't have that all up and ready to go yet, but that's in fact the ultimate goal is because we think although people should consider a whole bunch of things about choosing a health plan, but that certainly would be one of them that I would be looking at. So yes, it will be visible by health plans. So, but we're not at the final boarding process yet. So there's a little bit more to be resolved before we display this and are ready to go live with it.
And it does not include medical groups at all.
Yes, right. Thank you, Barbara.
And I kind of got from the question, we're not taking the report card and the complaint data and doing anything to do any comparison ourselves. They're two separate. I think that's kind of what you're asking.
We haven't made that decision.
I think we might link them up. That's not the only thing that people will be deciding on, but they will be on our website, and they will, in fact, people can look at that, and that be connected to the profile page. I just don't think we know yet. I'm willing to say that 1,000% for sure, because they haven't finalized all that.
Thank you. The next question that we got in is, what is the time frame for releasing the total cost of care rating? Will it be an off-cycle addition to the medical group report card? And what will be the communication plan regarding that release?
It will probably be done before next October, but it won't be done in time for this October. And as soon as we can get everything organized and set as to how we want to display it, it will be, I guess, off-cycle would be as good as any. And I think we will, we think this is a big deal. I think we'll have a communication plan. If I were to say what that was this minute, I would be very sure. It's not firmly set out yet because we're still working on the report itself. But there will be some interest from industry. I think there'll be interest there'll be some interest nationally as well as statewide media. So I think we will do something about this, but I'm not exactly sure what that will look like and how big of a fanfare it is. But and I'm happy to send a note to Eddie, who's on this call with our help with AQA, saying this is the release next week.
Our process in terms of our instant transparency is to be sure that the people who are being reported on have a chance to look at their information before it goes public. So the process that we'll be going through and starting September 23rd. So we would certainly anticipate having that opportunity for medical groups who are have a total cost of care added to their report card page, have a chance to look at the reporting before it goes public.
Thanks, Beth and Barbara. A question that we got on the chat is where can we find more information about the timely access compliance rate, the methodology, etc.
Through the Department of Managed Healthcare section on timely access complaints and reporting, and they've got all methodology for gathering the data on their website, but as Beth noted, we not come to any sort of decision process or decision points on how to report that out publicly. Those plans and medical groups that are in the process of, who are being collecting the data and reporting it to the DMHC, they're gathering taxes compliance rates for groups at county level for 3 types of coverage: publicly funded, large group commercial, group and individual commercial, which is going to result in a number of timely access compliance rates. So how we integrate those into our public reporting and how to make sense to consumers is a very interesting process.
Also, in fairness, the DMHC has had a whole series of stakeholder meetings. They've had some for consumers, they've had some for health plans, they've had some for medical groups, where I admit they've been in Sacramento, but they've had ability for people to call in. So as you become familiar with this law has been on the books, I think, since 2002. So it's the world's longest implementation date. But they are doing this very carefully and with great attention to the people who are affected by this and consider what they think of it. And it is, I think, by no means set yet, as Barbara described. So I urge you to get engaged in that so that you can have some input on it. I sat next to Bill Barcelona from G at one of these stakeholder meetings. I said, I'm trying to get my groups engaged in this, and I hope they're paying attention. And so, might not want me saying that, but well. But anyway, there's a lot of people in this and have participated in a lot of these stakeholder meetings. And so have comments. I mean, because we are the public reporting part of this, but we're not the people who decide exactly how this information will be put together and reported. I truly believe that DMHC is very interested in doing this in a sensible, equitable way. So I urge you to get involved if you haven't been up until now.
Thank you, Beth. That's all the questions we have through the chat. Vicki, are there any more questions on the phone?
No other questions at this time.
Very much. So I think I'll just put up this last slide here with more information. And as I said, we will be posting the slides and the recording of this. And if any other questions come up, please feel free to email us.
Ready for attending.
This concludes today's conference call. You may now disconnect. Presenters, please hold the line.